There's no easy formula for fixing our healthcare system.
We need to fix our broken healthcare system so costs are more affordable and treatment is more accessible.
We are looking at a much lower standard of living for the next generation.
Our healthcare system is in very deep trouble.
We have to address the crushing costs of healthcare this year in this administration.
I'm concerned that if the government steps in, it will eventually push out a private healthcare plan that millions of Americans enjoy today.
The U.S. spends more than $2.2 trillion on health care each and every year. Now, that's more than any other nation in the world. President Obama wants to spend even more money with his universal health care plan, but as we have seen in England and Cuba, well, this comes at a very huge cost. So how do we keep what works in our system while getting the most from the money that we do spend? Well, maybe it's time for some conservative solutions to this dilemma. Now, we spoke to key Republican figures on Capitol Hill who have some expertise on the subject. Why? Because they're also doctors themselves. Earlier this month, two physicians, Georgia Congressman Phil Gingrey and Pennsylvania Congressman Tim Murphy, co-founded the GOP Doctors Caucus. Now, they formed this with the hopes of crafting health care solutions that offer quality, affordable coverage within our free market system.
We knew we had, I guess you could say, a critical mass of medical professions on the Republican side with a lot of great ideas, and so we are organized and trying to focus those ideas, hopefully to develop a piece of legislation that when the time comes that we can submit as an alternative, our Republican second opinion.
This GOP Doctors Caucus has already started formulating its own prescription to fix our broken health care system that involves giving individuals the ability to choose their own health care provider.
We want to encourage patient ownership. We don't want patients to be in a situation where they're bound to an employer because of health care. So we feel that if you're going to allow employers to deduct take a tax deduction for a health care benefit, then an individual ought to be able to do the same thing.
One of the 13 doctors in the caucus is John Fleming. He's a freshman congressman from Louisiana and also a practicing family physician. The main reason he decided to run for office was to help reform our current health care system.
As a practicing physician for many years, I've been frustrated by the inflexibility of the healthcare system. We seem to be stuck in really the last century, and politicians have been unable to solve problems. So I decided to throw my hat in the ring as well, and I'm very happy to be in Washington and ready to go to work on healthcare reform.
And he's not wasting any time. Congressman Fleming also supports the idea of patient choice.
We need to have a system where we have large groups, provider networks that compete against each other, that utilize the latest in technologies, including electronic health records. There needs to be a system in which every patient can opt in without any concern about pre-existing illness, and that if they're poor or perhaps just above the poverty line, that government pays their premiums, but through a sliding scale mechanism where the higher the family income, the less subsidy comes from government. And we need to have a system that has one quality for all. And the only way we can achieve that is to allow private health care access to everyone.
But it isn't just the House Republicans coming up with good ideas on how to fix America's health care system. Republican doctors in the Senate are also taking up the cause. Oklahoma Senator Tom Coburn is a general practitioner who has been treating patients since the early 1980s. He's also pushing for Americans to get an individual tax rebate to purchase their own health insurance. And Senator Coburn strongly believes the best way to cut health care costs is through prevention.
We need to emphasize prevention. There's tons of money that we can save if we can do that. 5 diseases consume 75% of all the money we spend in health care. Those are preventable diseases. So one of the things we would do in health care with our bill is incentivize prevention and give rewards for prevention. Competition will produce excellence, but we need to have a transparent market with which to do that.
But prevention is only one part of Senator Coburn's solution. Another key part of his legislation would give medical professionals tax credits for donating their services at free health care clinics.
Incentivizing individuals to donate their time and give them a tax credit, so we are actually helping those people who have problems, don't have coverage, don't have the coverage that's adequate to their needs.
These lawmakers personally know the needs of doctors, healthcare professionals, and patients. They know firsthand the toll that healthcare costs can take on a family. So before we start adopting President Obama's universal healthcare plan, a plan that's proven to fail time and time again, hey, perhaps we should, listen to people like Senator Coburn or Congressman Gingrey and Fleming and get perspective from those who actually know the system from the inside out.
I've had approximately 30 years of observation of doctor-patient interaction, and what I've seen is that the key to cost control in healthcare is what is happening in the medical exam room itself.
I've practiced medicine for 26 years as an OBGYN specialist. With that many years of experience in dealing with insurance companies, and those are the things that I think we could bring to the table.
So we don't need to spend more money on healthcare. What we need to do is make sure it's spent more efficiently.